I'm Andrew Ross, Sorkin of the New York Times, and welcome back to the DealBook DC Policy Project. We're thrilled to have you back on day two of this series of conversations. Our next guest is going to talk and help us understand what's happening in the world of healthcare and vaccines and testing amid this pandemic. I am thrilled to introduce to you the new president and CEO of CVS, Karen Lynch. I should tell you, she just took the helm of CVS earlier this month and became the highest ranking CEO, female CEO in the world. CVS Health is ranked the fifth largest company on the Fortune 500 list. Karen, thank you so very much for joining us this afternoon.
Oh, thank you, Andrew. It's a pleasure to be with you today. I look forward to the conversation.
There is so much to talk about and so many lessons that I know that you've been thinking about throughout this pandemic and so much work ahead. And I want to talk about vaccines and testing and those lessons that we've all been thinking about. But I wanted to start with you and your own personal story a little bit to help introduce you to this audience. You know, you have a remarkable backstory, and I was hoping we could begin by talking about why you decided to get to healthcare in the first place, because I've always found it a really moving event that began this journey for you.
Yeah, Andrew, this journey for me began when I was 12 years old. I came home from school one day and I found my mom. She died by suicide. And that had a tremendous impact on me, as you might imagine. And for years and years and years, I didn't talk about it. And then in my mid-20s, my aunt, who was my mom's sister, who took care of me and my siblings, who brought us up, was suffering from lung cancer and breast cancer, emphysema. Her and my mom smoked a pack of cigarettes a day, and she was in the hospital, and I didn't know what to do. And I remember sitting in the hospital, the nurses and doctors coming in, talking to you in, ways that you didn't understand, or because you're you're emotionally distracted, not understanding what they said. And, the priest coming in, and, I made it sort of my life's mission to try to figure out, one, how do I connect healthcare with sort of the mind body, because my mom with her mental health issues and kind of physical health, and then just trying to figure out how do you simplify this crazy healthcare system that we live in. It's a maze and it's incredibly difficult. So I've made it sort of my passion and my purpose to really figure out how to help people navigate the complexity of the healthcare system, and how to really think about bringing that, the connections between your head and your body. And I have a passion for healthcare and to make it simple, make it more affordable. And that all stems from those early experiences that I had. And quite frankly, Andrew, just recently in the last several years, I broke my hip on a cycling accident and managed to have to navigate the healthcare system once again. And from that came some innovation through a new product that we rolled out afterwards when I came home. And I said, why isn't all this stuff at my fingertips when I come home? Why can't CVS Health bring me my medical equipment or bring me my prescriptions? And we rolled out a new product called Healing Better. So I had three big events in my life that have really impacted how I think about healthcare, and hopefully have some kind of empathy towards it because of the experiences that I've had.
Well, you very much do. I'm curious, it was complex then, the system that is, and it often feels very complex even now. Do you think it's better than it used to be?
I think it's more, it's more complex. It's there's more to healthcare now. There's not only the physical experience, physical places of care. There's now virtual care. There's more specialists that we interact with. There's complexity in diagnosis. There's more treatments. There's different approaches to healthcare. So I think it's even more complex than it was back then. Which is all the more reason that we have to think about helping people navigate this maze that we all live in today.
You did just take this job in this new role this month. So I have to ask you, and I'm sure you're now going to be introduced over and over again as the most powerful female CEO in America. How that feels and how you think about that.
Well, Andrew, for me, it's really not about the title. For me, it's making a difference and impacting the healthcare system, having the ability to impact people's lives. The way I approach the role is with a high degree of responsibility and recognizing that we can make a difference in the health of the American lives today, and that I take it very seriously that that opportunity exists for the 300,000 colleagues in the company, that we interact with people on their health journey every day. And that's how I think about it, because it's a mission, it's a purpose, and it's a passion. And it's something that I don't think about myself. It's more about what we as
But
a
can I ask,
company
was
can
this
do.
something that, did you always say to yourself, one day I'd love to be CEO of this company? Did that seem to be a possibility? Did that seem realistic to you?
Um,
If we were together 10 years ago or 20 years ago?
I always knew that I would be in a leadership role, and I always knew that that I would be doing something that would have impact on on the country. And this is what I didn't say. Oh, I'm going to be the CEO. I always said I'm going to be a leader. I'm going to make a difference, and that's how I've approached my entire career, Andrew.
Well, you are jumping into this role at a time where you can make a real difference, given the state of this pandemic that we're all living in and the challenges ahead. Help us just understand the way you see it in terms of the vaccine rollout right now and CVS's role in it.
Yeah, we are playing a very important role. And early on, we were working with the federal government on the long-term care facilities. We were selected by over 40,000 long-term care facilities, which included skilled nursing facilities and assisted living facilities. And we've been an integral part of getting shots in arms in those facilities. We started in late December. We've completed almost, we're through the second doses of our skilled nursing facilities. We're almost complete with the assisted living facilities. And what's really great to see, and the CDC just came out with these numbers the other day, we've seen an 83% reduction in infections in long-term care facilities since we started vaccinating people. And we've played a big role in that part. And I have to tell you, Andrew, I am very fortunate to work with amazing, amazing colleagues at CVS Health, because they're the ones who've been on the front line since the beginning of this pandemic. And they're the ones who are changing the way people move from anxiety to hope. And we've seen that time and time again as we've been going into these long-term care facilities. And sometimes, Andrew, really like going bed to bed to bed. And the satisfaction that our colleagues have had is just amazing. And we're really quite proud of that.
In terms of the broader rollout, when do you expect that I'll be or other people will be walking into a CVS and literally getting the vaccine there?
Well, we're already participating in both the state and federal programs. We have about 700 of our stores that are open or will be open by the end of the week. We'll be announcing we're expanding capacity later this week. We'll be in 17 states by the end of the week. We're getting about 500,000 doses a week right now, and we expect that to ramp up over time. So as the federal, all of it is dependent upon the supply. We expect to see increases in supply increase dramatically from April to May. We expect to see, another 100 million from May to June, probably another 200 to 300 million doses. So as that supply increases, you'll see more and more stores open up across the country. We have the capacity with our 10,000 stores across the US to do 20 to 25 million shots per month. And so we're ready. We have 90,000 professionals that are ready, and we have the capacity. And as soon as the supply is available, more and more stores will be open.
What do you make of the debate around allowing people to effectively get the first shot, but not saving the second shot, with the idea that that supply will come online later?
Yeah, the supply will be there. So, I think it's important to get the shots in the arms. We know we're seeing, both Pfizer and Moderna, and I have to give them a lot of credit for what they've been able to accomplish to get these vaccines. We know the EUA for J&J is, being reviewed right now by the FDA. The supply, we expect the supply to be there. So I think it's important that we start getting those first doses in. I would tell you, Andrew, at CVS, we are, what we've been doing, and we have phenomenal digital capabilities. We're not only scheduling your first dose when you come into a store, we're scheduling your second dose so that you're guaranteed that slot to come back for that second dose. And we have the tools to be
Right.
able to do that.
Maybe a hard question given where you sit to answer, but how do you grade what the FDA has done and the CDC in terms of the approval processes, the way that this has been rolled out? Some people look at it, and obviously this all happened in record time, and so it's hard to find fault in that. But at the same time, people are comparing the rollout here in the United States versus what's happened in the UK, for example, where the AstraZeneca drug was approved, and clearly they seem to be moving faster.
Yeah, I think, and I can only speak to our experience in working with the CDC and the FDA. We've been working with them for a number of months, making sure that we had the right supply chain, the way we were thinking about it, the right capacity. And so, I think there, with anything the size of what we're trying to accomplish as a nation, you will have some bumps in the road, but I think we're seeing, you're seeing capacity increase. You're seeing the sites in states increasing. You're seeing the ability to get people in stores, and larger sites happen every single day. So you can't do these kinds of things without having some bumps, but I think we're well on our way to accomplishing what the president has asked, to get 300 million Americans done vaccinated by the end of the summer, and I'm hopeful that we'll get there.
When you think about the future, and you think about the future of the business and just how vaccines will fit into that, I've been vaccinated at a CVS before for the flu.
Well, thank you for that.
Do you think this is something that is going to be repeat business? I mean, are you saying to yourself, we need to invest more in being able to vaccinate for the flu, vaccinate for various versions of COVID over the next several years? What does that look like to you?
Yeah, we are one of the largest, places where people go for vaccinations, particularly flu. We did our largest number of flu vaccinations ever this year. I think, as we think about the business going forward, there is, will continue to be, vaccinations required for COVID. I'm not a scientist, but, all the literature that we're reading is that, there will likely be an additional booster shot, next year for COVID. Clearly, the children, we haven't even thought about, haven't even started vaccinating them. We need to make sure that we're vaccinating our children going forward. So it is an important element, important part of our business. We'll continue to play a vital role. And it's really part of our strategy to be in the community when people need to have a site of care where they need something to be done. We're the place that can happen. And, it's really clearly part of our in the community strategy of healthcare. And you've probably heard me say, and I say this all the time, healthcare is local. And
Right.
you need to be where people want to be met, and that's what CVS is.
But is that something that you have to sit around the boardroom and say, okay, guys, I think over the next couple of years, we need to invest in real CapEx in maybe even creating areas in our stores that maybe build them out even more, because we're going to have more vaccination sites. We're going to be doing this more regularly. how much thinking and planning and even expense projections do you have to put in place for that?
Well, Andrew, we've already been doing this. We've been, we have our CVS Minute Clinics, we have
Right.
our health hubs, and we are spending, capital in investing in health hubs, where this is really a center of healthcare delivery in the local community. And what we've been building out is, an own local care delivery team, where we have a nurse practitioner, where we have a pharmacist, where we have a care concierge, and where in some places we have a behavioral health specialist. So we've already been making those investments, and we'll continue to do so. Andrew, part of our strategy is we're in the community, but we also have to think about being in the home and being digitally connected to people. And because the way you have to think about healthcare of the future is people are going to want to access healthcare in a variety of different ways. They'll access it through digitally, they'll access it in the
Right.
community, and they'll access it at home. And we have all those capabilities today.
I want to talk about the digital piece and the competition and everything else in just a moment, but two more questions related to the pandemic, if you will. One is about testing, which is to say you've also been doing a lot of testing. Is that something you imagine is a long-term business, is a short-term business? What kind of investment do you have to make in that regard? And how do you even think about it?
Yeah, let me tell you a little bit about testing. So we started testing very early on in the pandemic. We actually started with these large sites and parking lots, and we started in Shrewsbury, Massachusetts. And Andrew, the day that started, it was like a windstorm, a rainstorm. It was crazy to see just what was going on, and we had lines of cars that we were testing. It has now evolved to over 4,800 stores where we're testing, and we're doing point of care and send in swab testing. And we are the largest testing company right now in the country, and we've done over 15 million tests for the country. I do see this as a continuation of, a healthcare need. I think people will continue to want testing. We've expanded to antibody testing as well. But I think this is what, I think as you think about the future of healthcare, as viruses emerge, people will want to kind of test and see what's going on, and they'll be looking for avenues to do that. So I think testing will be, continue to evolve. But it's here to stay for a little while with
But
us.
is it something that you think is going to happen on an outpatient basis at a clinic like yours, or is it something that you think actually finally does move to the home in a meaningful way? Is there a way to do you imagine that somebody's going to create a test that's as good as a classic PCR test, for example, that can be done rapidly and in the home?
I think with everything in science, it will evolve over time. So likely to happen, but not, I think that like you've seen that happen with all kinds of testing. So I imagine that it would be in the home. The ones today aren't as good as a PCR, as you know. So it really requires, if you really want to know how, whether or not you are testing with COVID, it's better to get a PCR test. It'll evolve over time like anything else,
Right.
but new tests will emerge and new
What,
viruses
what
will
about
likely emerge.
what about PPE supply
Yeah.
and how you think about that in the future? I mean,
Yeah.
are people always going to have masks in their house and in their home? Do you imagine N95s or something that become sort of a standard?
I hope not, but I think masks are with us for at least until 2022, until we get everyone vaccinated. We still don't know when people are vaccinated if they're carrying the virus, which is why the CDC is still recommending that people wear masks. So I think masks will be with us for a while. Andrew, I'll tell you, when we started this pandemic, when we had to find supplies for our own colleagues, we spent a lot of time looking for masks. And I remember just having people, our supply chain people telling us, hey, the plane's on the tarmac and it's coming in. And,
Right.
hopefully won't be in that situation anymore because we'll have adequate supply. But I think for the near term, I think for the health and safety of the nation, I think it's important for us to really think about wearing masks until
Oh,
this is behind us.
okay, I have one other somewhat controversial
Yeah.
issue that's come up out of this, which is how do you feel about requiring employees to be vaccinated?
Yeah, so that's a great question. We've had a lot of debates in our company. I think it's a company by company response. I think that a lot of companies are thinking about the incentives and incentivizing people, their employees to get vaccinated. We've done a lot of work on this. We found that 85% of our employees want to get vaccinated. So we feel, so they understand it. Obviously, we're healthcare company. I think they understand the importance of it. But I think each company has to make those decisions for themselves.
Let's talk a little bit about the broader business and maybe some of the lessons of it. I'm curious, you have lots of stores, and obviously you are in lots of communities around the country, but clearly the other component of this world is the electronic one, the digital one, where people are ordering online and getting these things brought to their homes, in some cases, day of, in hours. How do you think about that long term in terms of the competition from the likes of Amazon and others?
Yeah, so digital is critically important. And as you look at the pandemic and what's changed, consumer behaviors have changed dramatically. They're demanding more personalization. They're demanding more online services. They're demanding convenience. So as we think about the competition like Amazon, we pay attention to them. But at the same time, we've been in the online business for a long time. We've been in the pharmacy delivery business for a long time. And, what's critically important to us and for our business is that we are there when, for people when they need their healthcare, that we're meeting them where they need to be met. And that's either through our digital assets, through our, home and community. We've been investing in digital capabilities. I mentioned earlier our digital capabilities for scheduling your appointments for our vaccine. We've scheduled it. It's very seamless. We've had strong stability of our digital capabilities, and we schedule what I call the round trip ticket for your vaccine. So digital is important. It's an important part of our strategy on a go forward basis.
Um, in terms of what that looks like, say 3, 5 years from now, do you think it's materially different? Do you see a day where you're able to deliver within hours in the same way that others may be trying to?
We do that today, Andrew. We do at home delivery. That was one of the
But
first
at
things.
scale, I mean, in certain places you can clearly do it. The question is sort of how this manifests itself over time.
Yeah, so I think for us, we do it today. We're in the home. We're there in the
Right.
community, so we have the ability to do it. I think we'll continue to see a progression of digital pharmacy and how we play longer term in that arena. But we have that today, and we can be in your home within an hour or two, just from the local store, if that's how you want if your prescription's delivered. So we're doing
Um,
it.
what about mental health? How do you think about the role of CVS in the context of mental health?
Yeah, so as you likely know, Andrew, we have a behavioral health company. We are very focused on connecting the head to the body. You heard me say that before. I think it's an important element of of our strategy. But quite frankly, Andrew, the pandemic has put a spotlight on the importance of mental health. We've seen more suicides. We've seen an increase in depression. We've seen an increase in anxiety. We've seen an increase in prescription drugs for behavioral health. So all across the board, this is, I called it early on the pandemic, this was going to be the second wave. We clearly have seen it. I think the implications on mental health from this pandemic are in its infancy. I don't even
Right.
think we know what the long-term impacts are. Before we started, I was talking to you about talking to teachers and kids in school, how, every day they're doing this online and how, now they don't want to be in front of computers, or, kindergarten children that are learning to keep everything to themselves and they're not learning about sharing. There's going to be a big impact on mental health and behavioral health. And I just think we're on the forefront. We put behavioral health specialists in our communities, in our hubs. But I think there's much more the country and the nation needs to do. We don't have enough practitioners. And so online will be an important element of how people engage in the mental health system going forward.
I also wanted to ask you about minority communities because clearly people of color have been disproportionately hit by the pandemic. And more largely, what type of policy incentives and programs do you think need to be put in place to get better healthcare systems into those communities?
Yeah, it's an important part, particularly not only healthcare, and I'll just comment briefly on vaccines because I think that's where we're seeing the underserved communities not getting access to the vaccines, and we're playing a very large part in that. We have opened up stores in communities that are underserved. We're actually doing outreach to those individuals in those communities and making appointments for them. Just yesterday, we started the calls and we made an appointment for an African-American man that's blind. And he said, I've been trying, and I didn't realize that, I wasn't going to do it until you called me today. So, it's an important part of our strategy to get people vaccinated, and we're doing it in the communities, and we're in the communities that are underprivileged and underserved, and it's a big focus for us. It's also a big education focus for us as well. So we're playing our part, and it's critically important to America.
We have a number of lawmakers who are watching us right now, policymakers in Washington. If you could talk to them, though, about what policies you think might be put in place or need to be put in place to either incentivize companies like yours or others to do more business in these areas. I mean, how do you think about just the sort of the policy framework that might help and improve this situation?
I think that is a really good question, Andrew. And I think the policy framework needs to be, healthcare for all, and the policies need to be supportive of not the underserved and underprivileged. I think their incentives need to be in those communities. And I think if you think about the framework, it really has to be an all-inclusive framework, and that there's a disproportionate amount of funding that goes into these communities, right, so that people can have access to healthcare, so that they're not getting the care that they need, that they do get the care that they deserve.
And what do you think about drug pricing? It's one thing, I have to tell you, the pandemic has changed my view, and I know it's probably changed a lot of people's view of the pharmaceutical industry. I think there was a view that the pharmaceutical industry was gouging the public for a very long time. And clearly, I think we've now seen the benefits of the pharmaceutical industry in creating what I hope will be a miracle of sorts in regard to the vaccine. But how do you think about pricing, and how do you think the public should think about pharmaceutical pricing?
Well, I agree with you that Moderna, Pfizer, J&J, they've all done a phenomenal job in getting us the vaccine. Relative to pricing, here's how I think about it. I believe that prescriptions need to be affordable. We all play a part and a role in that. It starts with the pharmaceutical manufacturing companies with their pricing, and we need to make pharmacy more affordable, and that's part of the role we in the entire healthcare system need to play.
Is there a piece, though, that you think could get taken out? Meaning, do you think there are middlemen, if you will, middle women, if you will, that are extracting a piece of this? I'll tell you, I was at a CVS recently, and the pharmacist said, "Oh no, if you just use GoodRx, you probably know what GoodRx is, and you can sign up for $5 a month or whatever it is, and they'll give you the first month for free. The price of the drug comes down by $150 all of a sudden, and you think to yourself, this is what's wrong with the business, right?"
I think there's a lot of various approaches to improving pharmacy costs. Yes, GoodRx does work in certain situations, but not all situations. You're sort of middleman, meaning I think the PBM, I mean, that they, one of the things that they do is really negotiate discounts and pass along those discounts on drugs. And remember, some of it is dependent on what employer groups do for their formularies and for their benefit design. So there's a whole host of pieces of the puzzle that we collectively need to, as a healthcare industry, look at and figure out how do we make healthcare more affordable.
Okay, final question. If we have this conversation together in 5 years, what does CVS Health look like?
CVS Health. So this is what I say to my colleagues. CVS is going to be there for every meaningful moment of health in a person's lifetime. And when people think about health, we'll want them to think about CVS Health for all their healthcare needs.
But is it something that I'm going to still think of it as on the corner? Is it going to be a hospital
you're going to think
chain
about
like
it all
Kaiser? Is it going to be in insurance? What do you think it looks like? How would you describe it to somebody at if you went to visit some kids at a school or you went to a cocktail party?
I would say if there's anything that you need for your health, so be it, I need insurance, I go to CVS Health. If I need healthcare in the community, I need an immunization, I go to CVS Health. If I need to have digital online health services, I go to CVS Health. If I need remote monitoring of health services in the home, I go to CVS Health. So we're your health services provider for all your healthcare needs, and that you don't just think about us as your corner drugstore. You think about us as your diversified health services company so that any of your healthcare needs are met by CVS Health.
Okay. When are you getting the vaccine?
When it's my time.
When it's your time. Karen Lynch, thank you for joining us. Really
Thank you.
Thank you for the conversation. You bet. Thanks so much, everybody. And thank you all for your questions and for joining us. We've got a number of conversations coming up this afternoon that we hope you'll join us for. Again, the CEO of Robinhood, along with the former chairman of the SEC, is going to talk markets with us at 2:30. And then later, Senator Mitt Romney. We hope you'll join us for both of those discussions and more. See you in a little bit.